Welcome everyone. It's nice to see you once again. I hope that you are here the second time, most of you, because it's our second educational webinar which is connected with treatments on the feet, on the pedicure. As you probably know, not always everything is beautiful on our feet. Sometimes we have a problem, smaller or bigger, and it's important to know how to work with the problematic skin, and today we will be speaking about problematic nails. On the nails we can meet different problems. Of course, mostly these are infections like fungals which are growing, and it's difficult to treat this kind of the problem, and also it's very difficult to put a good diagnosis without specially tests, mycological tests. Today I want to show you a different problem, the problem which is connected with the onycholisis. Onycholisis is diseases which is working like this, that the nail plate is not connected with the skin, it goes up. The reasons of the onycholisis can be different. Of course, it can be a sickness of our body, some kind of immunological, aggressive sickness like psoriasis, atopic skin. But very often it's our fault, because very often we are wearing too long nails, too long time. We don't come back to the treatment to remove, for example, gel polish design from our nails. And when we are wearing too tight shoes and we push the nail too much, unfortunately, we push them up and we take them off from the skin, from the nail bed. Very often also psoriasis can be the reason of the infection. And this is something what we need to recognize in correctly way. Today we have amazing model with two first nails on the left and right feet with this problem, and I will try to show you how to recognize the problem, how to put correct diagnosis, and how to work with it in the salon. We can do sometimes, of course, the reconstruction of it, because it's summer and we want to wear open shoes, we want to wear sandals, we want to show our feet. When we have sickness, when our nails are not nice, we can say even ugly, we are ashamed, we don't want to show it. So our job, like pedicure experts, podiatrists, it's to help these clients. Remember about one thing, not always we should listen our clients, because in the summer especially, the ladies are saying to us, put the color, it doesn't matter, next month I will cure it. Don't look on it because tomorrow I have a wedding, I have a holiday. They don't think about the problem which is connected with infection. And unfortunately, if we will listen to clients, if we will agree for beautician reconstruction, for applying the color on the problematic nails with infection, the problem will grow very quickly, and unfortunately sometimes can be too late to cure it correctly. So today about these topics. My name is Eva Rycerz and I'm an international trainer and educator in the Victoria Wien and Farm Food brand. Today we will work definitely with the farm food products, but also some of them will be connected with the nail designs directly, so it will be from Victoria Wien. If you have any questions, please feel free, because on the chat is our team, which you cannot see, they are on the backstage, and they support me in the cameras, in the microphone, but also in giving you the answers. So if you have any questions, remember, we don't have stupid questions. If you don't know something, if you want to ask about something, feel free, just write to us, and my friend Camila, she will ask me, she will read me your questions, and we will give you the answers. One more thing, prepare something to write if you don't have it yet, and prepare some notes, because during our meeting I will tell you, I think, a lot of important informations about technique of work, but also about our products and about ingredients. And after some steps, I will make you some clever questions about it. If you will give us the answer, and if you will be the quickest in it, remember, first 3 persons with correct answer win some products from us to test, because we want to share with you our products. We are sure that when you test it, when you try it, you will be satisfied of that, and you will recommend it to next persons. So be with us, and right now we are changing the camera on the feet of our model because we want to show you directly how to work on the problematic nails. We are ready. Here on the first nail, as you can see, we have half almost of the nail plate with the onycholisis. This white area, it's the area of the nail plate which is empty under, so we don't have connection with the skin. Look how deep I can put the excavator. You see, it's empty, and unfortunately under this nail is amazing place, amazing area for infection, for pathogens which can grow very, very easy. Also in the shoes, it's dark, it's warm, and very often it's wet. So we create a great place to let the grow the infections. On the right feet, is it good, visible? Please give us a few seconds. We have it. Here, as you see, the problem is a little bit bigger. It's on all wideness of the nail plate, and half of the nail almost is not connecting correctly with the nail bed, and here the situation is the same. As you see, the color of the nail plate is a little bit maybe yellowing, and in some area it's even a little bit darker. Maybe it's not green, but it's different than it should be. We can also see the different shape, that the shape of the nail plate is not correct. So before you will start working, you need to ask the client what is the reason, what has happened, how long time is this situation, and important is to ask about her sicknesses. How long time ago she has done some tests, does she has a problem with sugar in her body, is she diabetic, because it can be also the reason. And also we should look on all feet and on the hands, because if the reason it will be, for example, psoriasis, you will see also the changes on the hand nails. So it's important to look on our client totally on all her body. And what we do at the first moment, if you want to take a piece of nail or a piece of skin which we have under the nail plate, and send it to the laboratory for the mycological test, because sometimes you can do it, then you cannot disinfect, wash and clean the feet. Because if you use at first the product for disinfection, unfortunately you will kill some of the infection, some of the pathogens, so the laboratory tests won't be true, won't be fair. Sometimes it can lie us. So at first we need to take a piece of it. If you don't do it, if you just want to clean it, if you contact with this, another specialist and doctor, and you know that it's not infection, you can clean it. And we have right now like this situation, so I can clean it and I can make a reconstruction, because I know that the reason of the onycholisis is not infection, it's not pathogens. Probably it's heating and wearing too tight shoes. So at first I use the product which is Septi Starter. Septi Starter, this is the product for disinfection, and here we have 76% of the alcohol. So this is the product which will help us to clean the feet, but in the same moment it's fully refreshing. In this product we have a nice smell, So we don't have to wash feet to work in pleasure. This product smells like a citrus, so it's refreshing for our client, but also for us. And here also is a product ingredient which we call Synodor. Synodor is an ingredient which is taking unpleasant smell from our feet. Remember about the area between the toes. Here we need to clean it correctly and put it between the toes and leave it for about 1 minute. Don't clean it with the towel because the alcohol needs to vaporize away by themselves. Then we are sure that the effect of disinfection and cleaning is correctly.
Guys, we have a request to zoom in a little bit more. Yeah.
Okay. Now we were done some first thing on both feet, but when we will start working directly on the nail, we will definitely zoom it closer. Is it okay now? It's better? Please write to us. Okay. At first, we need to remove this area of the nail plate. So we need to cut it. You can use the cutter for the nail. We do it slowly, and when you put it with the left finger, left hand, hide it a little bit because the nail plate can jump and hit you in your face. So it's important to work in the mask and in glasses during the work with the feet. When I was in Estonia, I don't know, is somebody here? Please write to us if you are from Estonia. We had a presentation in the trade house in the company of our distributor and partner also. I know that in Estonia the rules of wearing and special aprons and how you can make feet, the treatment on the feet, they are really very restrict. So not everywhere it's like this, but remember that it depends not from the government, but from our own decision, how we work and how we are caring about our and our client's safety. Okay, is it visible good now? Can we make it closer a little bit now? Look, I cut it more and I will show you now. Look, I cannot cut more because here the skin doesn't let me to go deeper. Look how many things we have under this nail plate. Oh, you see, I do it very carefully because it can be painful for the client and I don't want to destroy this area of the skin. I want to cure it in the future and I want to care about it. So in this area we are working very carefully. Because this part of the nail plate is difficult to cut, I will remove the rest of it with the drill. And at first, I like to work with the drill bit, which normally I use to remove the gel. When the nail is thick and very hard, you can work with it. Remember that on the feet treatments, we should work with the drill with vacuum. So the dust is taken by the drill inside and we don't breathe with it. And now very carefully I make the nail plate thinner and remove the other part of the nail plate which is not connected with the skin. All the time I'm connected with my client. Never ask, is it painful? Don't make this question. Because if you ask, is it painful, then you suggest that it can be. The better is to ask the client what is she or he feeling. Is everything okay? And then the client is feeling more safety, trust us, and also we know is everything okay during our work.
Eva, we have a question.
Yeah.
Can you also do it with ceramic bit?
Yes, it's important just that you must know that not all white drill bits are really ceramic. Some of them are plastic. So it's important to choose correct one and choose this really ceramic, because these plastic ones sometimes are burning during the work very much. Okay, I don't use the brush. I use mostly safety starter to clean and to remove the dust. And with the sonda and or excavator, I remove everything. I clean and I'm checking how deep more I can go and clean this nail plate. Okay. And now I will put here my instruments. It will be cleaner, as you can see. Can we make the camera a little bit closer? I will show you one thing. When you see like these corners, like these elements, it's very important to control that you need to cut it and remove carefully. You cannot leave it. Sometimes when the client has really a lot of skin on the back sides of the nail plate, we don't see this part of the nail plate. If you will leave it like this, unfortunately, after a few days, probably they can start growing, and also this can be a reason of the infection. So now, when I see that the nail plate is again thinner, I once again take the cutters, and now it's definitely easier for me to cut and to remove other part of the nail plate. Okay. And now here, I don't know, is it visible in the camera, but in this area we have some small black points. Okay, this is dirt, but sometimes these black points, these are the vascules which are breaking and growing and pushing under the nail plate. Be careful, because sometimes it can bloody, and we need to work here really careful. Okay, and now I'm changing the drill bit, and I take some small ball. Can we do it very close? If you can see, this ball is not a diamond drill bit. This is the drill bit with small knives. It's very sharp. So very carefully I can clean with this drill bit all small details and elements around the free edge. I'm working on the speed about 12,000. I clean the free edge of the nail plate and the skin under. I try to take the position which will be comfortable for my camera operator and for you to see how I work. You see? Unfortunately, still the nail plate here is very, very thick. So I take one again this drill bit and try to make it a little bit thinner.
We have a question. Do you have this drill bit in your products? Can I buy it from a
This one, yes, definitely. This ball will be probably very soon.
Would you use any other drill bit for this procedure?
Yes, I will show you in 2 seconds. I will use our flame to push cuticles and clean the area around the cuticles and around proximal fold. Okay, and now you can see that here the nail plate is really roundy, the free edge, and it's quite thinner. I will clean it. Okay, I will do it with the cotton. Okay, and here you can see how does it look. When the onycholisis is very fresh, unfortunately this area can be very delicate and even painful. So be careful, sometimes it's better to do it on the 2-3 steps. Don't remove everything at the first moment, especially if the client, for example, is working in some physical work, is wearing heavy shoes, and we know that can destroy this area one again. But if you know that at least for 3 days the client will be at home or can wear soft shoes and don't push this area, and that the client will listen our recommendation how to care about it, then you can clean it like me right now. Now I will clean the area around the cuticles. So I will take my flame from Victoria Vin, and this flame is very nice and special because of the different small cutters here. These small cuts are removing a little bit the earth during the work and the temperature, so it's not burning so much during the work. And now I push a little bit the cuticles. Here also with this drill bit, it's easy to go on the back sides. Then I change the direction and I work on the left side. And with this also I can a little bit buff and match the nail plate if it's necessary, but in this case I have done it before also when I make the nail a little bit thinner. I clean it one again, and now very delicate I cut the cuticles. Here we don't make a combinate pedicure. We don't push the cuticles too much. Okay. And in this moment, if you want to make this area softer, make the nail plate a little bit softer, you can use for that the product which we call point softener. This is the product with oily substances and green tea inside, so it's antiseptic, and you push here and drop a little bit and put it around the cuticles. It makes it definitely softer and easier to clean. You can also put the directly drop around the cuticles on the back sides, on the lateral sides, because it's definitely easier to clean it perfectly, especially if you have the cones under the nail plate and around the cuticles. After 2 minutes, you just clean it. You are checking, is everything clean and everything okay? And at first, I want to show you how to treat this nail without reconstruction. We have in our offer 3 products which will help you to treat this kind of the nail plate and the problems with the onycholisis. Onyplasma blue product. This is the product in which main ingredient is colostrum, tea tree oil and aloe oil. Colostrum and aloe oil, these are the ingredients which are pushing the process of the regeneration, and they will cure the area of the skin which is under the nail plate and also help the skin to keep it moisturized and push this process of the regeneration. So when the nail will be regrowing, in some moment should it cure and connect one again. Still, remember, as I told you, that we need to recognize and put good diagnosis. Is it infection? Is it fungal or not? What will happen is if our diagnosis will be wrong. If here are some fungals which are so small so we cannot see that, and we will put this product, remember that colostrum is a milk. So we are feeding our fungals, so we give them food and let them grow. So if our diagnosis will be wrong and the reason of the onycholisis is not heating or pushing on burning in the very wrong and high shoes with high temperature, then unfortunately the fungals and different pathogens will grow quicker. What do then? Very quick resignate from this product, clean the nail plate one again, and if we put the diagnosis that it's infection, then definitely choose this product. This is Silver Booster, and in this product the main ingredients is silver, which is one of the oldest ingredients. I don't know, do you read and do you like history, but in old times, in Romans, they use the silver ions and drop them in the big, how to say that, places when they keep the milk or water, because the silver fight with the pathogens. So the water wasn't wasn't bad. The same was with the milk. Do you remember Napoleon? Napoleon was a person who decided to use silver like an ingredient which was put inside of the bidons which the soldiers used during the war and keep the water in it. So as you see, the silver is really one of the oldest ingredients. Here also you have a lot of oils like clove oils, tea tree oils, lavender oil. So it's very oily substance, and it's really strong antiseptic. And also here we have clotrimazole. Clotrimazole, this is the ingredient which is medicine, and it's fighting directly with different fungals which are feeding the keratin from the nail plate. And now I want to show you how I protect this nail plate if I decide that I don't make the reconstruction. We will put definitely Silver Booster at the beginning, because...
Two questions.
Yeah.
Yeah, sorry.
No.
So the first question is, if the nail is so thin and sensitive, doesn't the point softener, because of the urea, hurt the nail or the skin around?
We put the point softener.
Yeah, but doesn't it doesn't the urea hurt the skin?
No,
of the nail?
no. If you use it just during the treatment, one time per month, it will not destroy. It will work like a transporter of the different active ingredients. It will make the nail plate softer, and on this area it will help in the process of moisturizing deep layer of the skin. Of course, push a little bit the process of exfoliation, but what we do, we can put a little bit of the point softener. If you want, if the skin and nail plate is thick, you can even leave it. If not, as you saw, I clean it and remove from the top, and then I put one of these product, like a product with the ingredients which are curing the skin and the nail plate. And urea is like transporter, so the silver, the tea tree oil, the vitamin B, everything can go deeper because the ions of these ingredients are bigger, and they need the transporter who will push these products really, really deeper.
And the second question, does the softener not grease the skin reconstruction? It gets greasy, like oily.
No, it shouldn't. Maybe if here would be an open wound, then can be the problems. But here we have just epidermis layer, which is maybe very thin because the skin is a little bit pink, but we don't have here blood, we don't have open wound here. So everything will be really correct. And now when you put it, I put this one. Yes? Because this is the strongest antiseptic product. But you can mix it, and you can mix it with the collagen, which will work also in the process of curing. You can put them both during the treatment, but what is the most important? The most important is that the client must use it at home. So they need to buy minimum one, but the best would be two of this product, and one is using at home in the morning and one, for example, in the evening. If, for example, the client is a swimming rescue, ratownik medyczny? Ratownik na basenie? Rescue... Lifesaver, somebody who is working on the swimming pool, and you know, this person is always with open feet and the feet are all the time connected with the water. So he should apply it as often as it possible. If somebody is working in the office, it's normal, can be 1-2 times per day, so it's not a problem. And now you can use the cotton. We have like this one, it's called Omnifix. You can find something similar probably in your medicine shops in your countries. Look, it's something like this. You pull it, it's elastic, and here we have a glue. So I put the cotton, and now I just cure it. Maybe it's even a little bit too short. And you need to teach the client to do it at home. And at home, every day, the client needs to do it just like this. How long takes the treatment? It depends. Mostly this kind of the problem. So the half of the nail has an onycholisis. It's about 3-4 months. It will be bigger or the longness of the nail plate is bigger, then the time can be longer. If the problem is because of the different immunological sicknesses, or we are a little bit older, so our age is the reason of the time how the nail is grow, because with the age, unfortunately, the nails are growing slower, so then it can be even half of the year. Okay?
We have one question. Silver booster and collagen power can apply both twice a day, same time, every day?
Yes, you can connect it.
Or do you do it only one in the morning and one in the evening? Or the same time, the two?
You can mix it, and you can put one in the morning and one in the evening. It depends from the client. Mostly the clients don't want mixed it because it's money, so the using of the product is bigger. So why you can connect it? Because here we have totally different ingredients. Here is collagen with, of course, a little bit of tea tree oil, but also we have glycerin inside, over 5%. So this product is moisturized, but the most important goal of this product is collagen, which is pushing the skin to the process of the regeneration. So here we regenerate the skin and the nail plate. Here we have the ingredients which are oily and they mostly fight with eventual fungals. So if you know that the reason can be even in 1% the fungal, you are not sure, use this. But if you are sure for 100% that the client, for example, danced all the night in high heels and she just removed the nail plate, she just push it, and the blood was under, and you need to remove and clean it. Of course, if it's not open wound, definitely I decide on the plasma. On the plasma, I always also recommend when we have atopic skin and when we have psoriasis, because these ingredients moisturize the skin, make it softer, delicate, and also push the process of the regeneration.
And how often we cover with bandage after we apply product?
Always till the moment when the skin will regenerate a little bit, because here you can saw that the skin was really soft and delicate and pink. If you wear just the shoes, which will be closed, they will touch here, so they will burn and sharpen it and destroy, so we don't want it.
Okay. Is there some product like this to help with fungus?
This one. This one we use for fungus. This one you can also recommend the client between the toes, because very often, especially with the age, and especially for the clients which has problem with sweating skin, there the fungals are growing definitely quicker. So like a prevention, like a supporting the treatment which the doctors and dermatologists are providing, you can use it with the medicines and on the skin and on the nail plate. And remember that the nail plate we have on the feet but also on the hands. If you have pseudomonas on the hand, which are very often when we remove the gel polishes, beard gels, the clients don't come back too often. So this product, like a prevention, is amazing. So I think that this is a good moment for my clever questions. I will hide the products, okay? I will hide the names. Please look on it. Remember the colors, because first question will be connected with it. Now I take it. And are you ready to write the answers? Okay, first question. What is the color of the product and the name of the main ingredient which we recommend on the nail plate in which we don't have fungals?
Okay.
We cannot put it on the nail plate in which is fungal. Cannot. The color and the name of main ingredient. 2 words. We will wait 1 minute. Camila is waiting.
We are waiting.
We see that you are thinking, checking.
Reni, Onychoplasma blue.
Bravo, we have first winner. So 10 seconds for the second answers.
Okay. We have Onychoplasma, but we also asked about the color, so I think it's not enough.
So we can give you half of the product.
Yeah, Rika said blue and milk.
Good. It's also half of the answer because colostrum is a milk.
Yes. I think we have 3 answers, so
We can. Okay, so first is done. Second question. What is the name of the product with the 30% of urea, which we use on the nail plate?
Okay, waiting.
We don't say which is correct till we will get 3 good. So we will don't say what is the good answer right now till we will see that 3 are correct. Okay, I see that you are thinking, working. Remember that you have some catalogs probably close to you.
Yes.
You should get the catalogs also on your emails.
Okay, is it a point softener?
Do we have 3 answers or not yet?
Oh, more than 3.
Okay, this is point softener, very well. Remember that this product you can also use pointly when you have some corns or some cracks. It will make the skin softer in this area. Of course, we shouldn't use it every day, but for example, 1 time per week, definitely yes.
Yeah.
Great. Okay, so I go to the next step. I will clean very quickly the second nail plate, okay? I will once again disinfect it. And now I will show you a little bit different method. So I will not cut it. I will just directly work with the drill, because sometimes it's also a good method. And sometimes it's impossible to cut it. So in this area where I see that it's onycholisis,
why don't we use it every day, the point softener?
because 30% of the urea is working like a strong acid. It's pushing the process of exfoliation the epidermis layer. And imagine the situation that you take a foot file and you remove the epidermis the layer every day a little bit. What has happened then? The skin is pushing the teals up more and more. So the skin is, instead of being soft, unfortunately is thicker and more dry. I have a question for you, because we are thinking with Kamila about the next topic of the webinar, and I can just tell you that the next meeting with you will be at 15th July, sorry, 15th July, it's also Monday, at the same time, and I would like to tell you more about the ingredients, how they work, what is this humectants, what is this emollient, what kind of transporter in ingredients we should have to push the process of curing and regeneration on the nail plate. So the question is it for you interesting topic? And now, as you can see, I'm cutting the nail plate with the strong drill. Sometimes it's impossible to cut with the cutters, so then very soft and very delicate and careful, you just clean it. Look, with the drill. And now you can directly see what we have under the nail plate. Look on it. This skin is soft, is wet. So we cannot leave it. Please, if you have like this client with this problem, we shouldn't leave it on the nail plate. We need to clean it. Even if your clients beg you to leave it. Look how empty hole we have here. Can we do it closer a little bit? Is it good? Okay. And if you will see here the nail plate is not going up so much in this area. still is not growing correctly. So I just clean the top of it. Here, very, very delicate. I just touch it because it's really soft. I don't want to destroy the nail bed. And now, if you can see, this area, the free edge of the nail plate is sharpened. And for example, imagine the situation that the client is wearing the socks and she's pulling the nail plate up on all the time. So you cannot leave it like this. You need to make it softer and round. And now I come back to my drill, which is stronger, and I clean it a little bit. I don't touch with this drill bit the nail bed. I just make here the nail plate little bit softer. Again, I clean with the safety starter. And now I will clean again the area on the back sides. And again, you can see that here our client, she has quite soft cuticles, but still my excavator is not going very well and very deep. So I use on the lateral side point softener and also on the proximal fold. I wait about 1 minute. It goes deeper, and look what has happened. You see how the dirt is going very quickly out? Here with excavator, remember, it's rounded from one side and the opposite side is the opposite direction. So this side, it's on the left side of the skin and this one is on the right side. So we push the skin a little bit out on the back and we can clean and check the side edges of the nail plate.
Eva?
Yes?
Can you tell us which drill bit are you using?
This drill bit is from the Victoria Wien offer. So you will find it.
Yeah.
This one also is Victoria Wien. So now you can buy it. This small one, which I like also, it's also from Victoria Wien. Only this one I hope will be very soon.
Okay. I will put it in the chat.
Okay.
You can find it.
Ask your distributors because definitely they should have it. It's really good quality. And believe me, it's for really at least, I don't say how many days because it depends from that how many clients per day you have. So in my opinion, it's for about even this one, I can say for at least 100 treatments which you remove, because mostly this one we are using to remove old designs like gel polishes. It's really amazing. So for this kind of work, one time, one nail, it's like never ending story really. It's amazing quality. Okay, I used safety starter because it helped me to remove point softener. Remember, it's oily. We don't work in oily substances because then the drill bit will not work correctly. And now again I clean the lateral sides. I touch a little bit even the nail plate, but here it's okay. The nail plate is really thick in this area. I want to clean it. I push it, I change direction, and now very delicate I push cuticles. A little bit up, and here one again I clean. I don't like to use brushes because after this kind of the treatment you should throw it away, or maybe you have like this one which you can put in the sterilization in high temperature, so only then it's okay to use it 2 times to different clients. If not, you can infect the next client with the fungal, for example. So I don't use it. I prefer to work like this and use septic starter and just the cotton. Okay, and one again with this small ball I will just clean. These small imperfections. And on this nail I will show you how to make reconstruction, because probably, as you know, in the farm food offer we have the product which you can use to cure and to reconstruct the nail plate and make the beautician treatment with this. What is important, when you reconstruct it, the client must come back to your salon maximum after 4 weeks. The best even idea is after 3, and we need to check is everything okay under the nail plate. Okay, here I have some small steel cuticles. Okay, this one I will clean a little bit later. And now I will show you how to work with these products. This is one set. Here we have liquid and we have gel. The gel is similar to the acrylic gel in the consistency. Still, in it we have special ingredients which are antiseptical and antifungal effects. In liquid, we just use it to work on the product on the nail plate. The liquid you will put a little bit, for example, to a small glass. And in this case, we don't work with the brush, but we are working with the wood stick. Still, before that, we need to prepare correctly the nail plate. And at the beginning, I told you that we will work a little bit also with the products of Victoria Wien. And to prepare the nail plate correctly, we need to use the nail prep. I don't recommend definitely acid primer, because acid primer can destroy the nail plate and can destroy the nail bed. So the best idea is to use this product. Here you can see the ingredients. I will show you how it's hide. Look. You see, because we don't have area on the bottle to do it, to write this all information normally, so it's hiding on the special sticker. And as you can see in these ingredients, in this product, we have only two main ingredients: isopropyl, ethyl acetate, and isobutyl acetate. Three kinds of the alcohols in 85%. So it's strong antiseptic, antifungal, antibacterial product. Still, it removes all thickness, all fats, and oil, all oily substances which we have done before. And we put it directly on the nail plate. Even if this product will touch the skin, it will work like a disinfection because it's alcohol. But try to use as much as it possible just on the nail plate. And as you can see, it vaporizes very, very quickly. So directly after that, I apply gel polish tape bond. Tape bond is a substance in which you will find also alcohol, but also some kind of oily polymers which are staying on the nail plate. Also here you will find all information about the ingredients. It's important to know what kind of product you use. And also with this product, remember, just on the nail plate. Here it's really important. This is only on the nail plate. And this product is not vaporizing. Tape bond, because this is product which is working like a tape, it leaves at a sticky layer on the nail plate. You see how it's shining? So now on this nail plate we can apply the reconstruction. Wait a second, I need to hide the camera a little bit because on this side I didn't saw before that I left some imperfections. Okay, we leave it for 30 seconds and we don't cure it. And here you don't have to apply the base. You can apply directly Reconstructor. Still, I directly recommend to use the product which we call Boost Base. What we have in this product? Here we have vitamins, we have calcium. Still, the most important ingredient which we have here, this is fiberglass. If you will open it, unfortunately our camera is very good, but I don't think so it's enough good to show you that in the small drop of this product are small hairs, like with the small hooks. So this product is catching the nail plate really, really good. And how we do it? You see the brush is almost clean and you push it really, really thin layer. If you feel that it's too much, you even can clean it and push just a little bit of the product. We don't want to have a thick layer, okay? And now this layer we need to polymerizate. And probably if you know, we have a new lamps. This is old one in our offer. The new one are with the battery. Unfortunately, this with the charger were sell so quickly that now you can make an order, but we need to little bit wait for them. They are really, really good. Okay, we polymerizate the base, minimum 30 seconds. It's enough because it's very thin layer and the power of the lamp is enough. And now we apply our Reconstructor. Oh, I have a new one. As you see, the products are finishing very well and quickly. Okay, we put the stick into the liquid and we take the product. Here we have quite a big area, so I take a bigger drop, and I put it on the nail plate. As you see, the color of the product is transparent. It's not just like that. It was the special done like this because I want to see what is under the reconstruction. And what I do, I put again the stick into the liquid. It cannot be too much, just a little bit. And with this flat area of the stick wood, I just put it on the nail plate and on the skin, as you can see. Push it a little bit around cuticles. I don't want to make a thickness, but it cannot be also too thin. Remember about the side edges. And I push it to the longness which the client is asking for, but remember, it cannot be longer than the skin. Because if the client again will wear the shoes, even Adidas, Nike, whatever, but closed shoes, unfortunately will pull it up. We don't want it. And remember that the nail is growing. So if you will build it longer, unfortunately after 2 weeks, the nail will be longer than the skin. So this is very dangerous. And the client can take it off with her own nail plate. We just do it when? We do it like an aesthetic treatment, but also to protect the nail bed from the heating and touching in the shoes. If the skin is really very thin and the touching is very painful, you also can use and do the reconstruction. And now we polymerizate it 60 seconds. It's not burning, so it will not destroy the nail bed. It's not allergic. We have this product since 3 years and it's very safety. Very important just is to remember that the skin under the reconstruction must be dry, and all the time we need to care about cleaning this area. But the pocket between the product and skin is definitely smaller than when we've got an onycholisis. Okay, 20 seconds more. If you have any questions, feel free. You can write to me, do you know this product? Do you know Reconstructor? Do you use it maybe in your countries yet? Did you sell it? Do you have like this possibility? How does it work in your countries? Okay. Because on the product we have a small sticky layer, you can use a cleaner, but also you can use safety starter and clean it. And now we just need to file it. Of course you can use foot file for that. Still very nice will be the drill. And you just correct the shape. With this drill bit you can clean perfectly around the cuticles. And you can also make a shape. Remember that 3H cannot be too thick. And if we touched here the skin, clean it carefully and remove. Okay. You can also use the drill bit like this one. See? And with the top. Instead of the file, you just can correct it also perfectly with the corn. Just put cuticles. Clean it and buff. And on this kind of the stylization, you can just put the top. You can also put just the collagen, buff it, clean it, and leave it just like this.
Could you tell us more information about Boost Base?
Yes, I just will put here the collagen and I will show you how to use it. Of course, the ingredients we are putting around the cuticle, because this is the area where the ingredients are going. But also, you can little bit push the skin at front of the free edge, because remember here we have the pocket, yes? Teach the client that, for example, after a swimming pool, when we go on the sea, we need to clean this area really careful. Even with the dryer, clean it, make it dry, and push the collagen directly under. Because of course we have the reconstructor, but we need to care about the skin between the reconstruction and the nail plate, because it's important that the natural nail plate, which will be regrowing, need to cure and connect with the skin one again. Okay. Okay. Right, I have here still some imperfections. I need to change the position from the top. Because if not, I don't see correctly, so forgive me if now the camera is not showing properly. But believe me, it's not easy to do it from the back side. Okay. This side we can also a little bit file. I will do it later with the normal file. You can also do it, but I come back to the Boost Base. This product, this is a base which is polymerizate in the lamp, and you can use it under all build systems and are under all the products which you need polymerizate in the lamp. So for example, we have destroyed nail plate even on the hand, and you want to make a gel polish or build system or acrylic gel, whatever, and you want to make the natural nail plate stronger. So this is a little bit like a conditioner, because inside we have calcium, we have vitamins, and we have fiberglass, which is refilling empty holes in the nail plate, and it's catching the hooks, the imperfection which we have on the top of the nail plate, and it stays really amazing and long time on it. It's not lifting, and it makes the stylization really with the long durability.
Perfect, thank you.
You're welcome. Okay, if you like it, you think it's okay, you like it, you would like to use it in your salon, you think that your clients will be satisfied of that?
We'll see.
Okay, now it's time for the questions.
Ooh, questions.
How many products you will find in the set of the reconstructor, and what kind of it doesn't have to be directly this the names of this product, but what we have in the set and how many products are there. Okay?
And what do they do?
Yeah. 3 minutes and 3 words. How many products are in the set and what kind of the products? Okay, we are waiting. We see that you are writing.
Waiting. Rita, 2 liquid and gel, 2 oil and gel, 2 products, 2 liquid and gel, 2 products, liquid and acryl gel. Do we have 3?
Okay.
I don't know.
So we don't have oil.
No.
We have liquid.
Yes.
We say it's podoliquid because remember it's not only liquid. When you will read the ingredients inside of this product, you will find the special antibacterial and antiseptic ingredients.
Yeah.
And Podomass, it's reconstructor. Really, it's acrylic gel, but not this kind what we apply on the normal design and hand extensions. This is also with antiseptical ingredients, so it gives us extra protection from eventual infections and fungals which can grow here. The infection will not grow on the product definitely, and under the product definitely it's slower if it's at all. So this is very important.
Yeah. So I'm sure we have 3 correct answers. We have like 20 or 30. So.
Okay. So the second question is,
Okay.
what kind of 2 products, and if you remember the names, it will be this goal. So write us the name of the products from Victoria Wien which we use before the reconstructor to prepare correctly the nail plate.
Okay.
It's not easy, I know, but these one of you which are working on Victoria Wien products, I believe you will not have a problem with it.
That's a hard question.
Hard. I can do it like this. I will remind you like this without the name.
Nail prep, tape bond.
One answer. We wait for the 2 more answers.
Tape bond. Nail prep. Nail prep and tape bond. Nail prep and tape bond. Nail prep and gel polish. Nail prep. Oh, we have 3 correct answers.
So, Camila, for these persons which have good answers, I will send for you
Yes.
Boost Base like a gift, okay? Because you are asking, I believe that maybe not everyone know it, but this product is amazing. If with us is anybody from France, you believe that it's really the best, because in France I know that almost everyone know it. Okay, my dear, I would like to say thank you today for your time, for your question, for your activity. I have a hope that my knowledge and this meeting will help you to be better and to give huge satisfaction of your work, but also help your clients in these cases. If you need more help, if you will have any rhetorical question which are connected with pedicure treatments, feel free and write to us on email. You can also send us photos of problematic fits and problematic situation. And I also would like to invite you on the Facebook for the group Farm Food, Podolog Farm Food. Camila will write you this name of this group on the chat, Podolog Farm Food, and be there with us, because a lot of instructor is there, and if you will send the photos, if you will write the question, we will help you, we will try to help you. We cooperate with the doctors, with the dermatologists, so even if we don't know something, we also consult, we are asking and looking for the answers for different problems. Today,
And also, I would like to ask if you want to receive a certificate.
oh yeah,
Please click on the link that I put in the chat and sign in. I will send you the certificate after the webinar.
yes, because after each meeting we will give you the document that you were with us. Also, this meeting will be recorded, so if you want to show it somebody else, if you want to watch with your friends, you can do it. This is the second free webinar, educational webinar with the farm food. Be with us because we want to share with you with this knowledge, and see you, remember, at 15th July at the same time on Monday. And one more thing, follow our social media, Farm Food International, because we will prepare for you some championship. We don't know what topic to choose, so we have some suggestions, and on the social media on Farm Food International very soon we will prepare for you some post. In it, under this post, you can choose the topic of the next meeting, what you want to see, with what kind of the problems on the feeds you don't know how to work, or maybe what kind of the products you want to know. The best answers will win, and maybe will get from us also some gifts. So thank you once again, and see you on 15th